Hey everybody, it's Teepa. And this past week has been FTD Awareness Week, Frontal Temporal Dementia or Dysfunction Deterioration Week. In other words, learning about the front of your brain, the temporal lobes, and how they change when you have a condition such as behavioral variant, FTD, aphasia, primary progressive aphasia, either a fluent or non-fluent variation, whether you might have a type of FTD that's more motor oriented, so maybe a cortical basal deterioration, or maybe a progressive supranuclear palsy, or maybe in motor neuron disease and deterioration, FTD plus ALS, Lou Gehrig's disease, where there's a motor component in addition to the cognitive component. And the cognitive component might look very, very different depending on who you are and who you were and what places in the brain there's high activity, and where there's not a lot of high activity of tau pathology. So TDP43 is one of the protein malformations that's very active when we start talking about FTDs. So this past week has been a recognition, acknowledgement, sort of like this is probably the third or the fourth most common type of dementia category of dementia someone can have. Tau pathologies are different than the beta amyloid and tau that comes with Alzheimer's. First symptoms will be different, and progression of symptoms will be different. Often it is the most common form of young onset dementia. And what that means is that it gets missed a lot. So the length of time between symptoms have started, they're very active, and there's a diagnosis tends to be even longer than it would be for Alzheimer's or vascular dementia or Lewy body dementia, because the person is not in the age group that we tend to think about, and the inconsistencies of the symptoms and the variability of the symptoms can make it pretty challenging, because not everybody is going to have impulsivity and really extreme shifts in personality. Some people do and some people don't. Not everyone is going to do something that causes you to whoa at first. However, over time, the differences between what this person does and how they do it and how they used to do it and how most people do it is fairly significant. So some of the things that might happen is it's just that I can't get things finished. And it's much more extreme than it used to be. I have unfinished things all over the place. And that includes finishing things I normally would finish, like paying the bills or maybe getting gas for the car or making sure that I put the lid back on the gas tank and close it up and that I pay for things. So it might look like I'm walking away and not doing things that I should do, and I'm doing it on purpose, but I'm actually not. And I do not tend to have problems if this is my symptom profile in memory right away. I might get lost, or I might have trouble keeping up with the passage of time and how long it's been and how long it takes to do things. However, my ability to hold on to data is not that bad. It's just my ability to get things finished or to shift my focus, or maybe it's to keep focused because it could be attention, or it could be decision making, like how I make decisions is so different. Now, if my changes are more in the temporal lobes, then you won't see those kind of shifts. You'll just see the the difficulty I have there are finding words or using words or understanding words or some combination of that. I may or may not have issues with rhythm. My rhythm may sound great, but the content doesn't make sense. I may have more trouble with syntax, like how a sentence fits together and what it means, and where I put in a noun and a pronoun and a verb. And So my comprehension or my production of that may be flawed. And so there's lots of ways language can fail, just like there's lots of ways things can happen in the brain. And then there's this wiring that goes from the surface of the brain into the deep part of the brain where mobility sorts of things might start being odd. So I might have problems with eye gaze in certain cases. I might have problems with chewing and swallowing or the actual ability to articulate speech. I might have difficulty with moving my skilled limbs in a skilled way, or I might not. So therefore, we have Lou Gehrig's disease having a connection. And then there's this really odd one, which is this late, which is limbic predominant, age-related, TDP, which is the protein 43. We've talked about it briefly. And then encephalopathy. So shrinkage of brain tissue, destruction and limiting brain tissue. What's weird about this one, whereas all the other FTD type related ones are for people who are younger, actually significantly younger, in their 50s, 40s, that kind of thing, except for young onset. That happens in Lewy body and vascular. Of course, people can be younger and have other kinds of dementia too. But what happens with late is I'm over the age of 80 and I start showing symptoms. And I really didn't have symptoms before. And my symptoms may have clustering more in the frontal lobe, temporal lobe, and in the hippocampal area. So I do have memory problems, which is different than straight out young onset. So this is quite a set of dementias and hence hard to wrap our heads around sometimes. But what's really vital is how we engage with people and how we support people and how we recognize when something's happening and get smart about getting the right help, the right support, and the right care in place for us and for the people we care about. Because it turns out FTD can be quite a tricky dementia to work with. And many organizations think, yeah, we can do this because they've worked with one person. And then you get someone else who has a different formulation and a different progression pattern, and it's real different. Self-awareness can really vary, as can awareness of others and willingness and ability to handle life with others. So some people need to be really in a space where they don't have a lot of people around them because they have awareness that if they're around a lot of people, they will not be able to hold on to their temper, onto their words, onto their behavior, while other people may have no awareness at all and may get themselves into significant amounts of trouble with legal issues, whether it's driving motor vehicles or whether it's spending money or whether it's being in social situations where I do something that I shouldn't, or whether it's being in a store and doing things that I want, but it's not really okay. Not everybody is a behavioral variant, but when people are behaviorally challenged by dementia, it's hard for us to imagine that they can't know better. But I might be able to know better, but I won't be able to do better. And it's not by lack of trying. It's because the parts of my brain that would allow me to do that aren't working anymore. So I wanted to use this Monday as a way to sort of wrap up because yesterday on Sunday I did TimFest. I did a little speaking gig and a little interacting gig to help us all sort of take a look at what happens when somebody's living with dementia, FTD type, and what does it mean to support someone? And the most important message I have is try not to isolate the person or the family. Recognize how devastating this is for young families and appreciate what a difference you can make in people's lives by choosing to use friendship. All right, everyone. Till next time, take care of yourselves, take care with your care. And I feel like Willie Nelson. I'm on the road again, as you probably guessed. Not in Hillsborough right now. We're up in DC. In 2 days, I'll be back in Hillsborough doing some speaking and some consulting and some work. But then I head out right away to Ohio for another conference. It's that time of year. And then I'll be back because we'll have a visitor in town coming to spend time with us, which we're looking forward to. All right, all. Till next time. If you have changes and you need support, let us know. We're here to help, to serve, to be curious.